revenue, I'm not going to preempt the negotiations that are going on in the Senate. I think this would be the wrong time to pick my preference. But remember, the Commission on Revenue Allocation had given its recommendation. I've already said that had the government operationalized Article 204, the what is it called? The Equalization Fund, which nobody is talking about and for which nobody has asked for accountability. The push and pull would not be there because the Equalization Fund directly targets the lack of infrastructure in the hitherto marginalized counties. So it is the fact that we are living as though the Constitution is not there that is bringing this push and pull. And also the lack of accountability at both the national and the county levels. Now, about the tours of CS Health, they are PR tours from where I stand. He has targeted counties that are doing relatively well than others. That is why he reached Embu and did not go to Kirinyaga, which has no infrastructure. Instead, the director of Kenyatta National Hospital is the one who went to Kirinyaga to aggregate the beds in the sub-county hospitals to show up the 14 we knew, to tell us now there are 200. I bet they even counted those ones of private hospitals to get to 200. Let the PS deliberately tour counties that are doing better and counties that are doing worse. That way the national government will be able to engage the counties and fix the gaps. Because when there is a pandemic, the national and the county have to work very closely together. So let's stop PR tours and make them deliberate tours to address the gaps. Let us see him tour a county without infrastructure and talk about it. He should have hurried to Turkana. He should have hurried to Marsabit where there was cholera recently. Because if we can't handle cholera, we are much more unlikely to handle COVID. We need more accountability, and we need an inventory of the COVID support received by each county. And the elected leaders also should be in those tours. They are not doing their work. Because in each county, apart from the governor and the MCAs, there are MPs, there is a women rep, and there is a senator. We are not hearing much from them about the state of preparedness in their counties, and I want to challenge them that it is time they gave us information on the ground. Now, on dissolution of parliament, long overdue, but I don't want to go too much into it. There will be another day this week when there is a public forum, which I'm invited to speak about this issue by the LSK. But I do think that the call for dissolution is just. And how can women get engaged? Fellow women, it's not by kneeling down and kowtowing to our fellow males in politics. It's a partnership of equals, being on the table as equals. We must reject tokenism, which is being perpetuated by the top leadership in this country. The gains we got in the Constitution, we did not get them kneeling down. We were at the table as equal partners. And that's what the women of Kenya, and especially the younger generation, must know, so that we take up our space and we demand, not request, demand implementation and equal share at the bargaining table. Now, measures, whether what the government has done for COVID is enough, absolutely not. The initial measures were okay. As the figures began to grow exponentially. As the challenge of preparedness in the counties arose, the challenge of PPEs, of theft, of resources meant for health, more requires to be done, and we have spelled it out in the statement. I thank you.
Thank you everyone for coming.